Hi, I'm Mike Jones. I'm the Chief Information Officer for Northern Devon Healthcare NHS Trust.
Brilliant. So we've seen over the past few years since the coalition government came in lots of changes in the NHS. How has that impacted you guys in terms of technology, and sort of what changes are you going through?
Okay, our main challenges and changes that we're going through are predominantly to introduce an electronic health record for all the patients that we serve, which is around about 400,000 patients covering 1,300 square miles of rural population of North and East Devon. A big challenge for us is obviously getting all our clinicians to move towards using an electronic system. Many of them are used to paper records in the past, but we hope that that will drive out sufficient efficiencies to pay for itself.
And how difficult is that to get people to move from paper to digital? Do people recognise the opportunity and are they happy to do it, or is there still sort of a cultural barrier there?
I think it's definitely a people problem. It's definitely a cultural issue. The systems themselves are quite well proven now in this country and in the States, so we've seen the benefits of electronic health records. But it comes down to how well you engage with your workforce to move them towards that way of working. And we've found that the best way to do that is to involve them right at the outset and get them involved in forming the vision of the future of the organisation. So what will your organisation look like 2 to 3 years' time when you've become digital? And if they can be involved in forming that vision and perhaps looking at where it's been done elsewhere successfully, they start to see what it actually looks like and can see how they might get there.
And when people buy into that idea, is it largely driven by the fact that they recognise cost savings and efficiencies, or are they driven by perhaps an easier way of working and benefits of the patient? What gets the buy-in?
What gets the buy-in? I think there are two factors. One is many clinicians obviously still work because they want to treat patients, and that's what drives them to come to work every day. So they have to see how that's going to improve their working lives and in doing so, how that's going to improve the care for the patient. What they often do in trying to understand that is what they often come up against is, well, how is that actually going to work on a day-to-day basis? So an example might be a consultant might say, well, I've got 30 patients to see, I've got a ward round to do, it usually takes me about 2 hours. How am I actually going to use an electronic system when I'm walking around the hospital, talking to patients at the bedside and asking my junior doctors to carry out specific tasks, order a test, etc. So it really has to be a practical, operational level understanding of how it will work on the ground. And once they can see that and perhaps try that technology out and prove to themselves that it's not as bad as one might think, then I think you start to get that change in mindset.
And what is your opinion of the cloud? I mean, are you sort of pro, are you risk adverse in certain areas? What's your sort of stance on it?
Extremely pro cloud. My view is that we should always look at cloud first, in line with the government policy around cloud first. We tend to discuss, or we like to discuss cloud solutions in a broader context of digital health services. So the first discussion we like to have is, what are we trying to do in the way that we provide clinical services to patients? How can we provide them digitally? Remote clinics, using products similar to Skype, for example, telemedicine, access to health records electronically. Once you start to think about what it is you want to do with your clinical services, you then start to bring in, well, how can we do that? And that's when you start to look at the cloud solutions first. And for us, the obvious benefit of knowing what your costs are, being able to scale and flex the solutions and not have the setup times and the procurement issues associated with a traditional on-premise model.
And how difficult is it for you guys to move away from the legacy and get to that cloud? And then also, are you doing most of this through the G Cloud, or are you taking a different route?
A combination of G Cloud and outside of the G Cloud. We found, for example, with our electronic health record system that we've just procured, that was very much a joint procurement with 2 other NHS trusts. So we had the buying power of 2 trusts. We wanted effectively a private cloud solution. We wanted it to be hosted in the UK for obvious reasons around storing patient information in this country. We wanted it to be a private cloud for obvious reasons around it not being multi-tenanted with other non-NHS providers. But we feel quite comfortable that in doing so, we've asked the right questions that you would typically ask anyway, even if you were going down the G Cloud route. In terms of G Cloud procurements, we've bought a number of systems through the G Cloud. For example, we've recently procured a system to record vital signs at the bedside using G Cloud and other services around infrastructure.
Okay, brilliant. How have you found that G Cloud experience?
It's been good.
Good.
Yeah.
Is there any sort of challenges you think they could improve upon?
And I think some of them have been touched on today. The search facilities within the product, is pretty much largely cosmetic. But I think if you know what it is you want to get, and you've done the homework in terms of looking at your requirements, then that will help you quickly get to a shortlisted number of suppliers. I've also found that we can get better prices than what are on G-Cloud through some strong negotiation with suppliers outside of that framework. Because I've found in one or two areas that the charges for storage within the cloud can be initially quite expensive, and there is room for negotiation. But it's a great framework to start with.
Brilliant. And how much of a challenge is it? I mean, people talk about cloud and, it's great and it's beneficial, but fundamentally it comes down to having a good internet connection a lot of the time. And when you're in a rural area like Devon, is that a challenge? Or?
I think it's a challenge for us, even if we've trying to access our data centre from a rural location. So whether it's on-premise or cloud, we find difficulties with that, where we've got certain rural areas where there is absolutely no connection. In some circumstances, we've come up with solutions that will work offline, and then when they eventually find a connection, can load back up to the solution. And I think that should work independently of whether it's a cloud hosted or otherwise. But I can't see any major problems that are specific to cloud over and above on-premise solutions around connectivity. The connectivity issue is just a general issue.
Okay, brilliant. And what sort of stage would you say you're at in sort of this transformation journey? Are you sort of at the beginning stages, and how far along are you?
We're certainly beyond the initial strategy phase. We've developed our digital strategy. We've done quite a bit of work on the planning and procurement aspects of major initiatives such as electronic health records. So, for example, with our health record solution, we're now in the implementation phase. We're looking at the future ways of working, and we're about to start the training towards summer with a go live of major parts of that health record system this year, late 2015. In other areas, we're already there. So, for example, we already use a cloud-based solution for all the rotas of all the clinical staff, doctors and nurses, so we can see all the rotas of working hours and who's on which shift. And we've linked that cloud solution with the NHS Professionals agency software, which provides agency staff, so that when we have a shift that is a bit light on staff, the systems talk to each other through the cloud, and effectively you can fill your vacancies with direct links towards agency staff. So some of it is actually happening now.
Have you set yourself some key milestones over the next couple of years? Have you sort of said, we've got to have the strategy complete by 2018? Or?
Initially now it's looking 3 years, where we want to be in 3 years, which will be 2018. So we are working towards having a full electronic health record in place, having gone paper light, probably not paperless, but certainly less paper within the NHS in some of our back office services around HR and finance.
Okay, brilliant. And the last question for you, Mike, is over the next couple of years, or sort of as you near the completion of your digital strategy over the next 3 years, what would you say are going to be the main sort of opportunities and challenges for you?
Main opportunities, absolutely transform the way that care is provided, maintain our position as a high-performing healthcare provider in the region. Challenges, convincing people that digital is the right way. In some cases that's quite a challenge. People are very familiar with paper and pen, and for them it works, and you've got to really go that extra mile to convince them.
Okay, brilliant. Thanks very much, Mike.
Thank you.
Cheers.